Ottawa is launching a $13 billion dental care program with kids and seniors aged 87 and over being first up for coverage. Applications for those seniors will open later this month before eligibility expands in the new year. The program has a $90,000 and below household income threshold. Dr. Juli Waterbury is in private practice in Kentville and is president of the Nova Scotia Dental Association. Dr. Waterbury, federal government using the word transformative. How transformative do you think this new dental plan will be?
This new dental plan has the potential to have a really positive impact on the oral health care of Canadians, for sure. As dentists, we're excited to see that the government has realized the connection between oral health and overall health. We're excited to see the investment, especially for our most vulnerable populations, including seniors and special needs populations and young children. So we're very excited that the government has made this connection, and that hopefully it will be transformative.
So what kind of coverage exists now in Nova Scotia, and what will this new plan replace?
So in Nova Scotia, we are fortunate that we do have several provincial healthcare plans. Nova Scotia has been fortunate to have a children's oral health program that covers children under the age of 12, or sorry, under the age of 15, to the end of the month of their 15th birthday. We also have a special needs program, and we have some specialized programs that deal with certain groups of people. So we're very fortunate to have some provincial programs that go a long way towards helping patients, Nova Scotians, access the oral health care system. In addition, 2/3 of Nova Scotians have access to third-party insurance plans through their employers, and that's a significant part of Nova Scotians' ability to access the oral health care system. So as the dentists of Nova Scotia, we don't want to see anything happen to those third-party insurance plans.
Yeah, and this program is supposed to be more comprehensive, but still lots of issues to be worked out, as I hear dentists comment on it today. I gather dentists have to more or less opt in, I guess, so to speak. Do you think they will?
That remains to be seen yet. Nova Scotia dentists and dentists all across Canada, we still have a lot of questions about this plan that need to be answered before we're going to know how many dentists will enroll in this program. The reality for many Nova Scotia dentists is that right now we're busy. Some Nova Scotia dentists are currently not accepting any new patients, and so opening this up to a significant portion of the population might further complicate patients and Nova Scotians' ability to access care in a timely manner.
Will there be enough dentists to do all this work, do you think?
We're hoping, but we've run some numbers and we are concerned. We're concerned that right now dental offices in Nova Scotia are facing a severe staff shortage. We currently don't have enough dental assistants or dental hygienists to make all of our offices run efficiently. And by 2025, we've calculated that Nova Scotia is going to need an additional 40 dental hygienists and another 70 dental assistants, and that's on top of the shortage that already exists. So it's a real concern for Nova Scotia dentists.
And so at this point, do you even fully understand how you or some of the other staff would be even compensated?
The details of the program that have been rolled out this week simply relate to how Canadians are going to be able to enroll for this program. Very little detail has been provided to us yet on what it's going to look like from the standpoint of the provider. So we have a lot of questions that we're trying to work with government to get some answers on. They've told us that in the new year, we will have the ability for dentists to start enrolling in the program, but we don't yet know how that's going to look yet.
Why wouldn't they enroll? Is it because they might just be overworked? Is that a concern?
They might be overworked. There are a lot of concerns that we have with some of the details of this program, and staffing is right up there at the top of the list for us. Like I said, a lot of Nova Scotia offices are without the staff they need right now, and we won't be able to see the influx of patients that this program is going to show. In Nova Scotia, we're expecting that next year, in 2024, it's going to be about 130,000 Nova Scotians who will be able to access care through this program. And the next year, in 2025, it could be as much as 270,000 Nova Scotians. Those are big numbers for a system that's already very, very busy and understaffed.
You alluded to this earlier, but how concerned are you that employers will start to drop dental care from the workplace benefits programs, for example, or the province drops its existing plan, and we do see an addition to that flood of people looking to take advantage of this new program.
Absolutely. We're very worried. We really want to get the word out to employers that we don't know what the coverage is going to look like under the Canadian Dental Care Plan yet. We need employers to stay invested in their employees. We need them to maintain these dental care plans for their employees because we don't know what the coverage is going to look like. But we know the great coverage that Nova Scotians have access to right now, and we don't want to see that change for people.
Yeah, lots to think about and lots to figure out. Dr. Waterbury, appreciate your points on
Absolutely.
this tonight. Thank you so much.
You're so welcome. Thanks for having me today.